ABGH, CCAW, take two.
Hi, my name is Dr. Sophie Balzora. I am a gastroenterologist and I specialize in the care of inflammatory bowel disease. I am at NYU Grossman School of Medicine, a clinical professor there, and I'm also president and co-founder of the Association of Black Gastroenterologists and Hepatologists, or ABGH.
And I'm Ugo Iroku, MD, gastroenterologist in New York City, general GI, but with a focus on inflammatory bowel disease. I am an assistant clinical professor at the Icahn School of Medicine at Mount Sinai, and also one of the co-founders of ABGH, the Association of Black Gastroenterologists and Hepatologists.
All right, how do you think AI is going to do?
What do you think, Dr. Ugo?
Well, I think that AI is going to probably have some data, but I wonder how well we'll be able to tie it all together.
Okay. I don't know. I think that there's going to be a lot of things that we disagree with, to be honest. There's Dr. Google out there, there's AI, people always looking up symptoms, and we kind of have to debunk a lot of myths these days. So I actually don't have that much faith in AI. I'm really curious to see what happens.
All right, let's see.
Can CBD from cannabis cure Crohn's disease?
No, CBD cannot cure Crohn's disease.
I'm going to agree with that very short answer from AI. I think there have been studies that have looked to see what benefits CBD may offer our patients, inflammatory bowel disease patients. And whereas there are some reported improvement in some patient-reported symptoms and some scores of quality of life, as a whole, when it comes to actually cure or even affecting the more important scorings, like what we call endoscopic scoring. So we're taking a look with our colonoscope and seeing whether or not there's truly inflammation in the gut. CBD is not affecting that. When it's looking to see whether or not there's an improvement in some of the blood tests or stool tests we might do, like our fecal calprotectin levels or our C-reactive protein levels, CBD is not affecting that. And so, long story short, may feel great, but not necessarily improving the disease and definitely not curing it.
Okay. Yeah, I would definitely agree with that. I will say I like what you mentioned about the symptoms, right? It's really important to know and to care about what people are feeling and how certain things that are safe can be taken with doctor supervision. But unfortunately, there's no cure for Crohn's disease. And ultimately, what we really see is most beneficial long-term is how the intestines look after we implement a certain therapy. And unfortunately, CBD doesn't hit the mark there.
Can the right diet completely control gut inflammation, even in IBD?
Diet can help symptoms but cannot fully control inflammation in IBD.
Okay. Ooh, the diet question. That's a good one. I'm going to have to go with AI. AI knows what they're talking about here. I think this is a good intro to this topic, right?
Yes.
So diet can do a lot for symptoms. Diet can do a lot for symptoms with patients with inflammatory bowel disease. And I think as people learn about their disease, learn about their bodies more, they'll find things that don't work for them, find things that they are very comfortable consuming. There are some special diets out there that have a lot of research behind them, like the specific carbohydrate diet, the exclusive enteral nutrition diet, where food is consumed through formula by mouth, a special formula that you work with a registered dietitian for, the Mediterranean diet, which I'm sure a lot of people are very familiar with. And overall, except for that exclusive enteral nutrition, what they find most often is that it really helps with symptoms. When we're talking about adults, symptom control can be improved with certain types of diets. But unfortunately, there really isn't any robust data that says that if you eat this, your inflammation is going to go down. If you eat this, when we look inside with a colonoscopy or upper endoscopy, we're going to find that the ulcers are gone or the inflammation is gone. And that's ultimately what we really want to see with the therapy that we give. So as much as we do care about how patients feel, we also want to see that improvement when we look inside someone's intestines or we do certain blood tests or stool tests that tell us, you know what, the inflammation is at bay.
I agree. I think diet will always play a role in the proper management of inflammatory bowel disease, and it might change. The recommendations might change, of course, from time to time, even over a person's experience with the disease. Sometimes if there's an obstruction, we might say go low on fiber. Sometimes if there's not an obstruction, we'll say increase your fiber. So there's a lot of details, but at the end of the day, over, multiple years of evaluation, diet alone is not enough. An important part of treatment, but not sufficient to get your inflammation under complete control.
Yeah, I would say that. So I think what AI did not say is consult your doctor and seek your doctor's recommendation for a registered dietitian in order to get those safe recommendations.
Another point for humans.
Yes.
Can your gut still be inflamed even when you feel fine?
Yes. Inflammation can still be active even when you feel well.
I agree with that. So yes, we do know both with Crohn's disease for sure, and even with ulcerative colitis, that a patient's reported symptoms is only part of the story of what's really going on. And so a lot of our big studies, where it's like Sonic trial and some other trials that have taken place over the past few decades, have shown us that with Crohn's disease, sometimes it's a bit of a coin toss in terms of how great a person feels. And then you do a colonoscopy and realize that it might be the opposite. So a person could feel great and show inflammation, or a person could have symptoms and actually on the inside look completely fine. And so unfortunately, with Crohn's disease and even with ulcerative colitis, a lot of studies have shown that there can be a disconnect between the way a person feels and whether or not there's true in the moment inflammation. And so the answer is, yeah, that's correct.
Yeah, I would agree with that. So I think that is why, though it is painful and very frustrating to get all of these tests. We tell patients we need the stool, then we need the blood, then we need the CAT scan, then we need the colonoscopy and upper endoscopy. It's for, these types of reasons, really to get a lay of the land, understand everything, not just what you're telling us, which of course, is important, but also, what your colon looks like, what your stomach looks like, what your disease is like as a whole.
Yeah. And that's important because you might feel well today, but we know for a fact the way that to most guarantee that you'll feel better in the next few years is that endoscopically, so looking under a colonoscope, that you look fine there. And so the person who has a colonoscope with biopsies that looks fine is the person who's more likely to feel fine in the years to come as well. And so we want the best for you. And so sometimes we ask for those stool tests and colonoscopy to make sure that we achieve that in your care.
Are advanced IBD therapies more dangerous than the disease itself?
No. Advanced therapies are generally much safer than uncontrolled IBD.
Okay, AI. Okay. I will say that I agree with that. And I like how they use the word generally, right? Everybody's different. Everybody's disease is different. But what we like to stress, especially at the time of diagnosis, when we're talking about changing therapies or there's just like a big change in somebody's care or the trajectory of their disease, is that ultimately the medications that we use, and we talk about advanced therapies, meaning those that are applicable to people who have more moderately severe or severe inflammatory bowel disease, they have been studied well, right? And they've been studied in people who have a disease that's similar to yours, and also people who have other diseases that affect their immune system. And so there are risks with every medication that we use, and sometimes very serious risks, but generally those risks are pretty rare, and we have a very close eye on you. So not only do we want you to feel better, we want you to enter remission, which means not only do you feel well, but your colon looks healthy, and your numbers look good on blood work. We also want to protect you from any risks of the medication, but generally we also have to talk about the risks of not taking the medication and what can happen there, whether it's colon cancer, unfortunately, small bowel cancers, nutritional deficiencies, weight loss, infertility. So all of those things, we are watching out for you. And so that's why we prescribe the medications that we do, with an understanding that there are risks, but generally they are pretty rare, and we definitely have an eye on them.
I agree. I think, having the long organ that the intestines are inflamed chronically, I think most of my patients get that's not healthy for them. And like you said, there could be increased risk of strokes, heart attacks, and the like, colon cancer from untreated disease. And so really we need to put out that forest fire, to use that analogy. And that's ultimately better for you than any water damage that might occur from the use of the hose. So
Love that.
yeah,
Good.
exactly. So the
for it.
advanced therapies are have their slight risks,
Yeah.
but the clear and present danger is clearly untreated disease.
Absolutely.
Can I stop my IBD medications once I feel better?
No. Stopping IBD medication without guidance often leads to relapse.
Yes, I do have to agree with AI on this one. This, of course, might be the number one question I get asked
Yeah.
on my patients who have moderate to severe Crohn's ulcerative colitis. Hey, doc, thanks for the meds. When can we stop this?
Right.
And the answer is I usually give is not now. Where I will differ from AI is that I won't say that we will never get to a cure. I do actually personally think that cure is possible. It's just not here right now. There are genetic, there are many potential discoveries and new therapies that might be developed over the next few decades. And so I'm not pretending to know the future. But for now, for this decade, yes, the answer is as it's been over the last few decades, which is it's very important to stay on your medications. And we have seen, unfortunately, because we've tried historically with different research protocols, and unfortunately, those patients who stop their medications tend to have a flare of their IBD. And so for now, the answer is definitely to stay on treatment.
Yeah, I would agree with that. There's so much work being done to look for cure, and I definitely appreciate that optimistic look. And I think it's important for patients to hear that because that's what we're all aiming for. And so when I talk to patients, especially when we're just starting on medication, the first question is, okay, so when am I getting off of these? How long do I need to be on these? Which are good questions. And unfortunately, the majority of folks do suffer from a relapse when they stop their medications. So I just tell people this is for the long haul. This is for the foreseeable future because right now the disease is chronic. So that is appropriate therapy for them.
Yeah, but two great things. One is that there was a time for some of our patients, they remember, and some of our older patients remember taking multiple pills throughout the day. And then now we find scenarios where people are taking much less pills. And so the reduction in terms of the amount of pills a person may take may improve. And then also we find scenarios where the dosing, even for our injectables, sub-Q or infusion, sometimes can be spaced. And so sometimes the frequency in which we're giving medication for a given patient may change over time. And so there's details for every single patient, but ultimately talk to your doctor. And if you do decide to stop out of your own autonomy, don't hide it from your doctor. We want to know so that we can walk through with you through that unadvised journey, but we definitely want to be there with you to help you should you start to have a flare.
Absolutely. Definitely well said. I think that there needs to be some really important conversations and critical communication, even if you want to veer away from what may be recommended to you. So it's always important to have that guidance from somebody that you trust who is helping work with you on your IBD journey.
Can I clean out my intestines with a detox tea?
No. Detox teas do not clean out the intestines and may be harmful.
Can you clean out your intestines with a detox tea? That doesn't sound like something you want to do or we want to be next to if you do. But yes, typically patients want to know, is there anything that they can take in general terms, whether it's probiotic blends, whether it's enemas, including caffeine enemas, that can help to detoxify their gut and their body. And it's an important question. And of course, there's a lot of marketing that people see on TikTok and other social media avenues that suggest that there are these potential cures out there. But unfortunately, the answer is no. There is no perfect detoxing of your body, whether it's with the tea, whether it's with a meal plan, whether it's with an enema. Ultimately, your body will detox through the natural avenues of the liver, of the kidney, of the skin in some cases. And so your body has its own way of dealing with toxins in your body. And although you might see a lot of marketed products, they tend not to be endorsed by your gastroenterology associations.
Yeah. And I think the other part is that not only is it not helpful, but it can be harmful, as AI has mentioned. So it is critically important that whenever you're trying to start a medication, even if you've done your own research through AI and on the internet, that you talk to your doctor about it, because there can be interactions with the medications you're taking. It can just be, very harmful to the intestines, especially when they're inflamed. So we really do caution against these sorts of things. And, the body, that's what it's made for, part of what it's made for is to detoxify things that don't belong there. So we really are very weary about those sorts of things.
That's right. Yeah, we definitely agree with paying close attention to your diet, your choices before it enters your body. But after that point, in terms of detoxifying with teas, answer is a no.
Yeah.
We agree with AI on that one.
Absolutely.
How do I know if I have IBD?
You might have IBD if you have persistent abdominal pain, diarrhea, bleeding, or weight loss, but only a doctor can diagnose it with tests like labs, imaging, and a colonoscopy.
Yes, definitely clap for that. I agree, 1,000%. The disease inflammatory bowel disease, or IBD, is a serious one. It's a chronic disease made predominantly by two subgroups: Crohn's disease and ulcerative colitis. And a lot of the symptoms that we talk about, a lot of the symptoms that bring patients to us are things like belly pain, things like blood in the stool, running to the bathroom or fecal urgency, sometimes incontinence, right? Not being able to make it to the bathroom and losing your stool on yourself, weight loss that you didn't intend to lose, nutritional deficiencies when we check your blood work. So all of those things are things that when we hear them, we say, oh, this could be inflammatory bowel disease, but it could be a lot of other things. And so that prompts the testing, which is blood work, stool tests, oftentimes a colonoscopy, maybe an upper endoscopy where we look inside your stomach, and then pictures of your abdomen, like a CAT scan or an MRI. But also getting information from you, not only just your symptoms, but other medications you take, your family history, because inflammatory bowel disease can run in families, your smoking history, all those sorts of things. So it's really looking at patients as a whole and seeing if the risk of IBD is there, and then getting the proper information, the proper data, and then figuring out if that's the diagnosis. There's not one thing that tells us this is Crohn's disease, this is ulcerative colitis, and nothing else. It's really that full picture.
Yeah, I have had some general gastroenterology patients come to my office and say, hey, doc, I want to get started on this IBD medication. And I tell them, well, there's only one problem. You don't have IBD. And so I agree
Right.
with AI in this case. It's important for the patient to be educated, to be activated, to be aware. But at the end of the day, that making that final diagnosis does take the expert to come in and to help guide you through a number of tests to make sure that the treatment you get is for the disease you have.
Yes, absolutely. I agree.
All right, so we're all done. How do you guys think AI did?
I think I'm surprised. I think over time, AI has improved in terms of some accuracy, but it is interesting that it never really gives a complete picture.
Yeah. I mean, it plays it safe, as it should.
That's right.
But I think, thankfully, that's where we come in. So I think the expertise, right, the years of practice, the context, right, of seeing patients with inflammatory bowel disease and their different journeys is a really important, critical additive. But I got to say, I was pleasantly surprised by what AI gave us.
Yeah.
So
I think ultimately AI is great for home research, doing your work to make sure you're aware of what terms mean or what things might come up with your discussion with your doctor, but ultimately not enough to cut out the doctor conversation just yet.
absolutely. Nothing replaces the conversation you have during your clinic visits and that support that you need and the trust that you have with somebody who's caring for your inflammatory bowel disease and you as a whole. So come see us.
And so we'd like to welcome you into our world. blackandgastro.org is the website. ABGH is the organization. We've created a doctor discussion guide for moments just like this. You might be home wondering what your symptoms mean, wondering how you can interact with your doctor. And we've created a guide to help you think through some of your symptoms and some of the questions you might have for your doctor to make sure that your next visit is the visit you need it to be.
Absolutely. So, we're here to empower and we're here to educate, and the Doctor Discussion Guide does just that. So please visit us at www.blackandgastro.org. Everybody always makes fun of me when I say www. Either way, find us there, and you'll get the information to help you have the most valuable visit you can. So good luck to you.
Yay, human.